When designing the next generation Open Targets platform, one of our aims was to facilitate the building of therapeutic hypotheses. The foundation of a therapeutic hypothesis is causal evidence for the association of a target and a disease. Building and scoring such associations has been the focus of Open Targets since we launched in 2014. Our ambition for the future is to go further. When choosing a target as the foundation of a drug discovery program, the association must be evaluated in the context of treatment of the disease to specify how and where the candidate will work to alleviate or cure the condition. In other words, a drug discovery program should be based on a full therapeutic hypothesis, which takes into consideration the drug modality, direction of effect, cell type, state and tissue, as well as the disease subtypes and stages. We also need to consider which biomarkers can be used to assess target and disease modulation. Here we take you through some of the specific elements that we believe will need to be considered. For the target, causal evidence for the association to the disease will remain the foundation of the hypothesis. However, we need to think of the target in the context of its local interacting molecules, including other targets, but also ligands and metabolites. Setting the target in the context of the overall network will enable us to think about how a perturbation modulates the system, but will also facilitate the search for alternate targets, or, particularly in oncology, combinations of targets. Although small molecules remain a major modality in modern drug discovery, biopharmaceuticals, degraders, and cell therapies are increasingly coming into play. We want to consider the suitability of targets for each type of modality, as well as the role of the modality within the therapeutic hypothesis. This brings us to the direction of effect and how we can gather information that will allow us to predict the nature of the target modulation we want to achieve. Genetic evidence will be important here, as genetic associations can contain both a direction of effect alongside an estimate of effect size. For instance, loss of function of PCSK9 or ANGPTL3 is protective for heart disease and lowers blood LDL cholesterol, but does not induce any other severe phenotypes, which suggests that inhibition is the appropriate target modulation. Can we exploit the genetics data to formulate these hypotheses more widely? Furthermore, in the context of a network, could we identify alternative targets with more facile directions of effect? Going deeper into the context, the cell type, cell state, and tissue where we want the medicine to work are key indications of cell selectivity and will help assess target safety risks at other cell types and states. Can we identify where the disease mechanisms are taking place using cell atlases? Finally, we currently have a relatively simple model of disease. How can we get more information about the disease in terms of the cellular origin, its molecularly defined subtypes and stages? How can we use this information to tailor the therapeutic hypothesis and guide it towards molecular biomarkers that distinguish the subtype and monitor the effect of modulation? Our aim is to build each of these components to enable the systematic construction and prioritization of therapeutic hypotheses, and to provide tools in our platforms to enable this analysis for targets and disease of interest. The revised infrastructure and front end of the rewritten Open Targets platform will enable us to more easily make these developments. We could imagine a future tool in the platform to query for specific parts of the therapeutic hypotheses. For instance, showing all targets with genetic evidence for involvement in inflammatory bowel disease that are predicted to provide benefit through an inhibitor and are expressed selectively in the gut and are tractable by an antibody drug. We recognize that other factors also remain important to position targets for drug discovery: drug candidate safety, unmet need, novelty versus standard of care, and other commercial factors. However, we believe that bringing therapeutic hypothesis construction to the fore is essential to prompt ideas and discussion to guide how future versions of our informatics ecosystem and wider research program can be built.